right, so I hope you found this series of videos on the patient history helpful. I know that I promised y'all that I would do a demo video of me going through all from step one, knocking on the door, all the way through the practical examination. And so thankfully, I was able to do that. I just recorded a quick demo of one of the chief complaints, just like I would expect a student to do it on the practical examination with a simulated patient. So I'm going to go ahead and play that for y'all here so you can watch it through. And then afterwards, we can go through it together and see if there's anything that I could have done better. Maybe some things that I might have left out, because of course I'm not perfect either. And I was also on the spot. So watch this. While you're watching it, maybe look through the rubric and see if you can kind of check everything off. And if you find anything that I didn't do, make a comment down below. Okay. Be sure to stay tuned though for after you watch that demo, so that we can go through how I would document it on my cheat sheet, and then also go through a few things that I might have missed. So I'll see you on the other side of that video.
All right, knock knock.
Come in.
Hi. Hi. Miss Garcia?
Yes.
Hi, Miss Garcia. My name's Christina, and I'm a physician assistant student with UTRGV. I'd like to take an opportunity to do a patient history on you to ask you a few questions. Before I get started, would you go ahead and tell me your name and date of birth?
Yes, it's Terry Garcia, and my date of birth is 1/1/83.
Great, awesome. And before we get started, I also wanted to double check. I'm going to ask you a series of questions and collect a history on you before the provider comes in. Is that all right with you?
Yes, that's fine. It's not going to take too long though, right? I'm a little bit in pain.
Don't worry, we'll do our best to do a thorough history, but also we'll not waste too much of your time here, okay? Um, so I see you're coming in for abdominal pain. Can you tell me a little more about that?
I mean, yes, yeah. What do you want to know?
Well, why don't you tell me first when it started?
This particular pain started about today around 12:30.
Okay. And has it been constant since then?
Yes.
Okay. Now that pain that you have, is it, how would you describe it?
It's kind of achy. It's very achy and sharp.
Okay. And on a scale of 1 to 10, 1 being the least amount of pain you can think of, 10 being the most amount of pain you can imagine, where would you rate it?
I would say probably about like an 8.
Okay. It sounds like it's pretty painful. So have you had anything similar to this in the past happen to you?
Yes, actually, this kind of pain, I've had it a few times before, but usually just goes away on its own. This time it doesn't seem to be going away.
Okay, well, I'm glad you came in so that we can take a look at it. Um, tell me about where the pain is located. I know you mentioned it's in your abdominal region, but can you be a little more specific?
Yes, it's like in the right upper area.
Okay, and does that pain travel anywhere else?
Mm, no, it's
No.
kind of just there.
Okay. And what exactly were you doing when the pain started?
Nothing. I mean, I had just eaten and it started shortly after that, but not anything else.
Okay, and would you say it came on gradually or all of a sudden?
Uh, Kind of gradually.
Okay. Now you said that you were eating right before the pain started. Is there anything that you've noticed that makes the pain worse?
Well, I guess maybe things I'm eating. My diet is a little bit spicy and greasy. I like the spicy foods, so um maybe those kind of things have aggravated it in the past.
Okay. Anything else that might be making it worse?
No, not that I know of.
What about anything that's made the pain better or that has made the pain better in the past?
Nothing other than just sticking to a good diet.
Okay. Now have you tried any medications for this pain?
No.
Okay. Any other treatments? Have you been to see maybe another provider for this type of pain in the past?
No, I didn't, only because it would go away, so I didn't think much of it. So by the time I'd go in for my annual visit, it wasn't there.
Right, that makes sense. So what about any nausea? Have you had any nausea related to this?
Yes,
Okay, well, can you tell me a little more about that? Is it while you have the pain, before you have the pain, after the pain, with the pain?
it's with the pain. Yes, I
Okay,
pretty much have been feeling nauseous all afternoon.
okay. And then have you had any episodes of vomiting?
Yes, I did vomit. I vomited since 12:30. I vomited twice.
Oh, wow. Well, we'll definitely, after we take this history, get you some medication to make you feel better. Um, did you have any blood or an abnormal color to your vomit?
No.
Okay. What about any fever? Have you had any fever?
Yes, I didn't think much of it, but yes, I do feel, I did check myself about 5 minutes ago and I have a 100.7.
Oh, wow. Okay. What about any chills related to that?
Yes, chills.
Okay. Have you had any diarrhea,
No,
constipation,
no,
any problems going to the restroom, pain when you urinate?
no.
Okay. And any back pain or flank pain?
No, no,
Okay. Anyone else with similar symptoms at the household?
no.
Okay. Well, I think I have a good idea of kind of what's going on. I'd like to summarize it back to you if that's all right. And please be sure to let me know if I mixed up anything that you mentioned to me. Okay.
Sure.
So you mentioned that you have a right upper abdominal pain that started a few hours ago. It's located in the right upper quadrant area. It's been constant since it started, and it came on pretty suddenly after you ate. The characteristic, an achy type pain said that, of course, after eating made it worse, and especially the types of foods you eat tend to provoke the pain, but nothing seems to relieve it, and you haven't tried any medications for it, haven't been seen by any other providers. You also report a little bit of fever, low grade, as well as nausea with 2 episodes of vomiting, no diarrhea, no constipation, and no problems urinating. Did I get that correct?
Yes,
All right. Well, like I said, I think I have a good idea of what's going on right now. But to get a better idea of your overall health, I'd like to ask you some questions about your past medical history, if that's all right.
yes,
All right. Are you allergic to any medications?
no,
All right. Do you have any medical problems like high blood pressure, diabetes, asthma?
no.
No. Okay. Have you ever been hospitalized?
Just for when I delivered one of my babies.
Okay.
Sorry, one
Any,
big.
oh, one baby. Any complication?
No complications.
Okay. Have you ever had any surgery?
No,
Okay. Do you take any medications?
just multivitamins daily.
Okay. Just over the counter.
Yes.
All right. What about any trauma? And by trauma, I know that's kind of a funny question, but anything that required like you to seek medical attention or go to the hospital?
No,
Okay. What about travel? Have you traveled outside of the country in the last few weeks?
no.
Okay. So I know you mentioned you have one child. How many pregnancies have you had?
Just one.
Okay. And you said no complications with the delivery of your baby.
Correct.
No. How old is your baby?
3.
3 years old. So they're already out of the terrible twos.
Yes.
That's awesome. Okay, a few more questions here. Are you up to date on your immunizations?
Yes.
Great. What about your yearly examinations, like your general checkups, well women checks?
Yes, I get those every year.
Okay, great. And then for when you were a child, did you have any youth illnesses like chickenpox?
Nope. I don't remember having any issues as a child.
Okay, well, that's good. So I think I know I got a little bit more history about your past medical history. Now I'd like to move on to the family history. So by family history, I'm most concerned with your immediate family, which is considered your parents, your grandparents, your siblings, and your child. Okay. So I'd like to start by asking you, are there any illnesses that run in your family?
Um, I don't know I don't know if they run, but mom and dad do have hypertension.
Okay, let's start with your mom first. Is she still living?
Yes,
Okay, so has high blood pressure been diagnosed? Do you know when she was diagnosed?
probably about 10 years ago.
Okay, is she on medication for that?
Yes, she takes lisinopril.
Okay, pretty well controlled.
Yes.
Any other illnesses that your mom has?
No,
No. What about her parents? Are they still living?
no,
Okay, sorry to hear that. Did they, before they passed, did they have any medical problems or issues?
no, I actually don't know much about them. Neither of the mom or dad of
Oh,
my mom.
okay, okay. So I know you mentioned your mom had high blood pressure and your dad also had high blood pressure. Is he well controlled? Is he on medication?
Yes, same lisinopril, and he is well controlled.
Okay.
Um, and
Any
he's
other any other illnesses with your dad?
no,
Okay. Do you have any brothers or sisters?
no,
Okay. And your child, you said healthy 3-year-old? Any medical problems?
no, jumping
Okay.
around like crazy.
Well, a few more specific questions, and this is just about your family history to get a better idea. You have any history of mental illness that runs in the family?
No,
Any history of drug or alcohol dependence?
no.
Okay, great. So I think I have a much better idea of your family history. Now we're going to move on to your social history. Now, social history questions are sometimes a little more personal, so I like to remind my patients that whatever you share with me will be kept confidential. Are you all right to proceed?
Yes.
All right, so tell me about your home life. Who do you live with besides your child?
Um, Husband?
Okay. Would you consider your husband to be your support system?
Yes.
Okay. Aside from that, do you live in a house, an apartment?
Yes, house.
Okay, awesome. Now, what do you do for a living?
I am a school teacher.
Oh, wow. So you have a kiddo at home and kiddos at school. That's full
Yeah.
time.
Yes.
So what grade do you teach?
Second grade.
Oh, wow. Okay. And did you go to university for that? Where did you go?
UTRGB.
Okay.
Uh,
And bachelor's degree?
yes.
Okay. That's awesome. Do you enjoy teaching?
Yes.
I imagine it can be a little stressful. Do you find time to take care of yourself? And by that I mean, do you watch what you eat? Do you exercise?
I try to, but I kind of fell off the exercise wagon about a month ago. And the eating part, I try my best, but I just love the spicy, greasy Mexican food, so that's a little bit hard sometimes.
Yeah, I can definitely understand that. Um, and of course, with your busy schedule, with your kiddo and your job, it can be extra difficult to maintain a good diet and exercise. Um, let's see, moving on. These are a little more sensitive questions, but I ask them of all of my patients. So, do you smoke?
Yes.
Okay. How much do you smoke?
It just helps me with my stress. So I smoke about three cigarettes a day.
Okay. And how long have you smoked?
I just picked it up about 6 months ago.
Okay. Well, I wouldn't be doing my job if I didn't mention that what's something you already know that smoking is not very good for your health, although I understand it can be very stressful and it can be very difficult to quit that. Um, but even just cutting down a little bit at a time can help your overall health. Okay. Now, do you use any recreational drugs?
No.
Okay. And let's see. Speaking a little bit about your sexual history, are you sexually active?
Yes.
With your husband, any other partners?
No.
Okay. And any issues in that area that you know of?
No.
Okay, great. So moving on, I think I got a good idea of your social history. I'd like to move on to what we call the review of systems, basically asking you some yes or no questions. Um, I'll ask you about a symptom that you may or may not have had in the last month to 2 months. If you have, you can just let me know yes. If not, we'll move on to the next symptom. Sound good?
Yes.
All right. So you already mentioned to me that you've had fever and chills. Have you had any night sweats?
No,
Any appetite change?
no,
Weight change?
no,
Weakness?
no,
Fatigue?
no,
Generalized achiness?
no,
Okay. Any hair loss?
no,
Sinus problems?
no,
Any vision changes?
no,
Any eye redness?
no,
Earache?
nope,
Dizziness?
no,
Any nosebleeds?
no,
Runny nose?
nope,
Sore throat?
no,
A hoarseness?
nope,
Cough?
nope,
Shortness of breath?
nope,
Chest pain?
nope,
Feeling like your heart's beating fast?
no,
Any swelling in your legs or arms?
no,
Any cramping in your legs?
no,
Okay. Any pain when you pee?
no,
I think we already asked you that, but any frequency of urination?
no,
Okay. Any pelvic pain?
no,
Abnormal vaginal bleeding or discharge?
no,
Okay. Any hair, I already asked about hair loss. Any weight loss?
no,
Weight gain?
no,
Any unexplained bruising?
no,
Numbness or tingling?
nope,
Any rash?
no,
Okay. Any itching?
no,
Pain in your joints?
nope,
Stiffness in your joints?
no.
Headaches?
Well, you said last month, right? In the last month, yes, I have had, I do suffer from migraines, so I do get headaches every so often.
Okay. And do you feel like you have a good plan for when you do get migraines?
Yeah, I mean, just get maybe like one or two a month and pretty okay.
You take prescribed medication or over the counter for that?
I've been able to just do the over-the-counter ibuprofen. That cuts it pretty well.
Okay. Well, if those headaches ever become unmanageable for you or you'd like to come see us, we can definitely talk to you about that a little more. Okay.
Okay, okay.
All right. Moving on to just a few more questions here. Any weakness?
No,
Um, have you had any feeling of depression,
no,
anxiety?
no.
All right. Well, I know those were kind of a lot of random questions, it sounds like, but it's kind of the net that we cast to catch any other symptoms that might be contributing to what's going on today. So thank you so much. I know you've been patiently waiting for some nausea medicine, probably some pain medicine too, which we will bring you shortly to help you feel better. This is the point in the encounter where we would move on to the physical exam. So we'd like to do that next if you're all right with that.
Yeah.
Do you have any questions for me before we move on?
No.
All right. So we'll go ahead and move on to the physical exam from here. Thank you.
Okay.
All right, so how'd I do? It's definitely nerve-wracking when you're being put on the spot because it doesn't feel as organic as a real encounter with the patient. When I walk into a patient room, I feel a whole lot more comfortable, as I think you will too when you get out into clinicals. But that being said, I went through and I kind of looked at the rubric to make sure I did or didn't miss anything. There's a few things I think that I could have done better. So let's go piece by piece. We'll look at the cheat sheet that I did and we'll kind of talk about it a little bit. Okay. First of all, this was a telemedicine encounter. So, as you would notice on the rubric, there's a step for washing hands. Now, you don't have to wash your hands when you're in telemedicine, but if you are doing your practical live, do not forget to wash your hands. Okay. Um, One of the things I think I could have done better overall was I think I could have addressed my patient by her name or asked her how she would have liked to been addressed. I think that would have made it feel a little more personal and might have made my patient feel a little more comfortable. Um, Now let's go through the HPI. Remember, I like old carts, but you might not like locates. I made little notes here because remember, I did need to summarize this at the end. And so I made notes of when things happened as I was collecting the history. I also included pertinent review systems in the HPI. So I included fever, chills, nausea, vomiting, diarrhea, and back pain, dysuria. I included things that were pertinent that would help me build my differential diagnosis. Now, there's some things I wouldn't ask. Wouldn't ask her if she had a runny nose, and it has nothing to do with this, right? Probably wouldn't ask her if her joints ache. That probably wouldn't have anything to do with this in the HPI. Now, later on in the review of systems, I can ask that, just not straight up front. One thing that I forgot to ask is her last menstrual period. I think with any female, she's a 40-year-old-ish female, but she's still in childbearing years, and I should definitely consider pregnancy or ectopic pregnancy on my differential before I rule out that. I can't say she's not pregnant, right? So she did tell me she was sexually active. I need to make sure that I document and ask that. So that's one thing I forgot to ask. I think it was pretty thorough though in my HPI. Once I pass my HPI on my cheat sheet, I'm writing mostly checks, maybe a couple little tiny notes, but nothing major. Okay, so I think I got all the points on this. I don't think I missed anything there. As far as family history, I did qualify who I was referring to as far as past medical history. I mean, family history was concerned. She did mention to me that her grandparents on both sides she was not familiar with. So, I didn't really ask too much about that. Um, I I also made sure to ask my psych, alcohol, drugs. Okay. Then I went on to social history. I think I touched on every single one of them. And as you would notice in there is no one right way to do it. But I tried to kind of segue one question to another and try not to make it seem like I wasn't paying attention to the answers that she was giving me. I definitely wasn't going like a robot from one thing to the next to the next. I was trying to kind of tie it all together. I also mentioned a little bit about smoking and how it was not good for her health. So I gave her just a little bit of education there. One thing that would have been better if I had taken just a step further is maybe to offer her help if she felt like she was ready to quit, that we could help her. And there was maybe some informational pamphlets we could give her. But there were medications out there that could help her. So I kind of dropped the ball with that a little bit too. But I don't think it was detrimental. I definitely showed that I cared about her in that sense. Then moved on to the review systems. Of all the review systems that I asked, I did not repeat my GI questions, right? Because I already asked those up front. I also, when she did say that she had migraine headaches, I addressed it. I didn't just ignore that she said yes. I asked her a little bit more about that. So that was necessary. Um, so that's my little cheat sheet here. What else could I have done better? I don't know. Let's go ahead and look at the other rubric. Let's take a look at the like style points and stuff and see if maybe there was a place that I could have done something better. So moving on to the rubric here, we can see that I did knock on the door. I welcomed her. I introduced myself. I gained consent, and I did verify her chief complaint. I also verified her name and date of birth. I didn't wash my hands because I'm not face to face, but if you are face to face, make sure that you do. Um, and then let's go ahead and look at the style points. So here's our style points: delivery, professionalism. It's a little more difficult to have eye contact and correct body language over telemedicine, but I think the patient could tell that I was paying attention. And when needed, I did demonstrate empathy. When she mentioned certain things, I made sure to empathize in the fact that she was having pain and that this was a lot of questions she had to answer, but that we were going to take care of her. Um, I did give her a closing statement, a transition statement to the physical exam. Um, so I think overall, I would probably get all my style and professionalism points for that encounter. So that being said, we just went through a demo. We went through my notes that I took, and then we went through the rubric a little bit to see. I think I would have done just fine grade wise, although the grade is not as important as the technique that you learn that's going to be your in and out for the rest of your career. Now, this is a very structured, complete history. Obviously, when you get into the clinic, everything's going to be a lot more targeted depending on which type of setting you're in. But this is a great starting point. We have to learn how to crawl before we can run, right? We have to do this complete history to know what all there exists out there for us to ask before we can start using our medical detective brain to either weed in or weed out certain questions that are pertinent to whatever chief complaint we have. Again, go through your chief complaints. Know what those accessory symptoms are that are related to it. Know what other kind of off questions you need to ask. That way that you're best prepared when you get to the practical. And don't forget to practice, practice, practice. Practice over Zoom, practice in person, whichever methods you have access to. And the more you practice, the better you'll perform when it comes down to practical time. So that being said, I hope this was helpful. If you have any questions about something I might have said or done, if you have any, critiques, something I could have done better, be sure to comment down below. If there's another type of content, another video that you want me to make regarding the practical or anything else, put a comment below and I'd be happy to tackle any type of video you want me to. So I'm here to help. Thank you so much, and we'll see you in the next one.